So I'm doing scenario one. So I will go and introduce myself. Hey, Mrs. Tam, my name is Raul. I will be the nurse assisting you today. I will be collecting a urine sample shortly. Would you be able to tell me how you're feeling? Do you have any burning or discomfort with the catheter? No? Okay, that's good. Do you have any urgency or urge to urinate? No? That's good. Okay. So I was reading your report, and I read that your urine is slightly cloudy and has a foul odor, and that you also have a temperature of 99.5 Fahrenheit, which is slightly above normal. Usually urine is clear, has an amber color, and has the typical urine smell, not foul, not pleasant, just a urine smell. These are indications usually and are symptoms of a UTI. Um, so we're going to be conducting a test called culture sensitivity, also known as CNS. This is a test to use to detect the bacteria that's causing an infection and to also determine which medication that we're going to be administering to our patient. So to you, to make sure that you regain health and that you don't have this issue. um, so this procedure is non-invasive. I'm just going to be obtaining a sample, a sort of sample from the port located on your catheter, and we should be getting the results within 2 to 3 days. Um, this sample needs to be sterile. So to perform this procedure, I'm going to be wearing, I'm going to be cleaning my hands, and I'm also going to be wearing clean gloves to perform this task. First, I'm going to have my gloves on. I'm going to have what I have. I'm going to get what I need necessary. So a 10 milliliter syringe to draw up my sample, alcohol wipes to clean off the port, the sample container so I could put the sample in that's sterile. And also, I'm going to have a biohazard bag so that we can ship it to the lab and get our results back. And I'm also going to have them all labeled with your name, date of birth, the time that we got the sample, and with my initials on the container and on the biohazard bag. Once all the equipment's here, I'm going to have the sample container open. I'm going to kink the urine tube so that we can obtain a fresh sample. Um, and once the urine is gathered up, collected near the port, I'm going to clean the port with an alcohol wipe. I'm going to attach the 10 milliliter syringe by lure lock, so it'll be tight and secure. And then I'm going to draw up 10 mils of your sterile urine, and then I'm going to place it into the container, close it, label it with your name, birthday, date of birth, my initials, and the time that we had gathered this sample. I'm going to place it in the bag, and I'm going to also label the bag with the same info. During all of this, the tubing is going to be released so that the urine is going to continue to flow into the collection bag. Once we perform this task, we should both be expecting the results to come in between 2 to 3 days, and we should know what's causing your urine to be cloudy and what to have this foul odor, and even possibly what's causing you to have this slight fever, this slight spike in temperature. After knowing what we get from your test, we can then prepare the medication once we get your results. And then we will be able to help you fight this infection and to hopefully fully, at our results, fully have you be producing clear amber urine that doesn't have a foul odor, and so that hopefully that your temperature will go back down to the 97, which is around normal limits. So while documenting all of this, I'm going to be using the SOAP method. So S is for subjective. I'm going to be writing down everything that you tell me. How are you feeling? How are you breathing? Because I noticed that you are admitted into my unit for pneumonia. So I will be checking how your breathing is also going. Seeing if you have any burning sensations while voiding, if you have any lower back pain, if you're feeling hotter because you had a slight increase in temperature. O is objective, so your vital signs will be placed here. I will also note that you had cloudy and foul odor urine. And I will also have here an importance that you had a temperature of 99.5 Fahrenheit. I will also note how your breathing is to make sure, so we can keep track of that since you are admitted with pneumonia. And I will also note that you are also alert and orientated ×3. For A, that's on our assessment. I would note that you might have a possible infection evidenced by temperature, cloudy urine, and your urine has a foul odor. Also, and that we are going to be performing a CNS, culture and sensitivity test, to determine to determine what bacteria is causing an infection, which is leading to our indicators that could possibly be a UTI. Also, we aren't sure if this is a hospital-acquired infection, but it's possible because you have a Foley catheter, also known as an indwelling catheter. P, that's our plan. So we're going to obtain a sterile sample for CNS and test and determine the infection, and then we're going to find out what medication we can administer to the patient to make sure that we get rid of this infection. Our interventions is going to be to obtain a sterile sample. I'm going to educate the patient and on the test and explain to her the benefits from the test. So make sure we're going to identify what's causing the infection, and we're going to get the medication for you to get rid of this medication. Also going to educate on proper hygiene, just in case, because you could also get a UTI not just from using a catheter. So proper hygiene is always good. I'm also going to contact the doctor to make sure to see if we have to keep the catheter in, or we could take it out, or if it needs to be replaced, so that we could reduce chances of you obtaining a UTI. Evaluation. So I'm going to make sure that that these tests are necessary. Show you the importance, why this test is necessary, so we could bring back your optimal health, so we could get rid of this infection, and so that we can have you going home shortly. The importance of hygiene, and to maintain communication with the doctor to see if we could remove the catheter, or if we need the continuance of the use of the catheter. So now I'm going to move on to my next patient. That would be Jamie. That's scenario 3. So I'll go and introduce myself. Hey, Jamie, I'm Raul. I'm going to be the nurse that's going to be attending you today. How are you feeling? Hope you're feeling well. I want to make sure I have the correct patient. So I'll be asking for your name, date of birth. Even possible, you could tell me your social security. Just to make sure I have the correct patient. Also, check the wristband. I will ask the length of time that this person has been taking insulin, since the order is to give a mixed insulin of regular and NPH. So the doctor has ordered a mixed insulin of 8 units of regular insulin and 32 units of NPH, subcutaneous, every morning. So a total of 40 units. So administering insulin is important because it helps you to regulate your blood glucose levels. So I will be explaining to you the importance of these 2 types of insulins, and why, and the importance of site rotation, because we don't want to produce scar tissue injecting the same site over and over and over. So, and also we are combining regular and this intermediate insulin into one shot, so that you don't have to keep on administrating, or we don't have to keep on administrating this injection into throughout the day. So you can have it once a day in the morning. So right in the beginning of the day, you get this injection and you're set for the day. So regular insulin usually starts working within 30 minutes once injected. NPH is the intermediate insulin that usually starts working within 4 to 6 hours. Combining these 2 will help you throughout the day. Before giving you this shot, I'm just gonna let you know that there's 2 possible locations we can inject this: in the back fleshy part of our arms, or in our lower abdomen, not around the umbilical area. So combining these 2 will help you so that we don't create scar tissue injecting these insulins throughout the day. Site rotation is going to help you because that's also going to prevent scar tissue, and that's also going to make sure that you get the whole benefit from the insulin using a new location. So for this injection is subcutaneous, so we will do this in the abdomen or the back of the arm. We will be using a insulin syringe, and it's going to be a 5/8 needle, and it's going to be, the gauge is going to range between a 25 to 27 for administrating your insulin. So I will be giving you this insulin using one syringe. First, I will be putting in 40 units of air into the syringe. I will get my regular insulin bottle, and I will clean the top. I will inject 8 units because that's what the order says. Inject 8 units of air in, then I will obtain 8 units of regular insulin. Then I will get my second, which is the MPH insulin, clean the top of that one, inject the rest of the remaining air, which is 32 units. But to properly make sure that I obtain 32 units, because we are mixing insulins and I want to get the correct amount. We don't want to waste medication. So I would draw off carefully 32 units. And to remember which insulin needs to go first, I usually remember it by clear before cloudy. So regular is usually clear, and MPH is cloudy insulin. So I will clean off the site of injection. So we're going to be, in this case, we're going to be using the abdomen. So I will clean that area with an alcohol wipe. And I will make sure that to give this, I will be pinching your skin, and I will be administering the shot in a 45-degree angle. Because it's subcutaneous, I would inject the insulin while pinching the skin, and then after that, I would discard into the sharps container because there's no need for that. We don't reuse needles, and then after that, you'll be able to eat your food throughout the day because we gave you a mix of insulins. And then I'll just be able to continue to monitor you and make sure that you're comfortable and doing well. So for my documentations, I will be using the SOAP method. So S is going to be subjective, so I'll be documenting how you're feeling in the beginning. Are you hungry because you haven't eaten, because you haven't your insulin yet? Are you feeling hot? Are you feeling comfortable? Are you thirsty? Any pain? All of that. Objective, I will be taking your vital signs. I will assess your skin for scars in any of the injection sites. And I'll also be checking your blood sugar levels. A is for assessment. So my patient's diabetic and needs a mixed insulin injection of 8 units for regular insulin and 32 units of MPH insulin, which is an intermediate insulin. My plan is to follow the order of 8 units of regular insulin and 32 units of MPH subcutaneous every morning. My intervention is going to be to educate the patient on the importance of insulin and the proper use of site rotation, and to even to check their own blood glucose levels to make sure that they know where their range is and how they're feeling and when it's time, and to stay on top of that rotation and schedule. My evaluation, I will monitor the blood glucose within the normal limits of my patient, and I will be educating them on mixed insulins, the differences, and also on site rotation.